I will show everyone now. This is a picture of me before I had nose surgery using the rib cartilage method. My nose used to be very big, and when I smile, it's almost completely stuck to the bottom of my nose. Now Dr. Tai can share with everyone the different method, and then we will talk about my journey with rib cartilage surgery. This is a case about Lily Luta. She said, I got my no job in career, but now it's really swollen. Can I come to you for checkup? So I said, sure, come over. When she came for a checkup, it turned out she had an infection. After deciding to have surgery in Korea, about 3 weeks later, the tip of my nose started turning red, feeling sore, and there was fluid. I also had a fever at that time. I got so scared that when I to the hospital to see Dr. Tai for checkup, Dr. Tai diagnosed that is what an infection. Currently, Lily has had her nose reshaped by Dr. Tai, and she is very satisfied with the result. So now her nose has been fixed using rib cartilage. Luna would like to send greeting to all the viewers. Today, as you can see from the title, we are talking about modern nose augmentation methods. Recently, I have received a lot of attention from everyone about my transformation and how I have changed my appearance. I would like to share that I had my nose job using rib cartilage. Let me show you something. This is a picture of me before I had rib cartilage nose surgery. As for my nose, it had its own unique feature of what people call crook nose that stand out and is unforgettable. The tips of my nose was very big, and when I smile, it's almost stuck to the bottom part of my nose. Also, let me ask you something. Have you heard about feng shui? They having a crook nose is not good, right? So what do you think about that? Well, to be honest, for women, a crook nose isn't considered very good. So I told you and said, hey, why you don't fix your nose? Ching that's crook nose for better feng shui. After you got your no job, something funny happened. Your song from a years ago suddenly became a hit again. So we both laughed and said, wow, we were just joking about it. And now look, it's like fixing the nose brought the song back. I also read some of the comments and people were saying that feng shui nose is no joke. Before Luna, there was did you I also joked with her and said, go fix your nose and you will pass your beauty contest for sure. And guess what? Right after she got her no job, Dunya became a runner-up and now it's returned. Another thing I want to share with everyone is the method I choose for my nose surgery, which is rib cartilage. I have heard about so many different nose augmentation methods. So now Dr. Tai, could you help me to share with everyone the different method? After that, we will talk about my journey with rib cartilage surgery. Everyone knows there's many methods for nose enhancement, divided into non-surgical and surgical. Non-surgical method currently include filler, injection, and thread lift. So what does non-surgical mean? It means minimally invasive. When should you choose a non-surgical method? These two non-surgical methods mainly work for cases where you don't have a high nose bridge. Filler is injected to raise the bridge, and thread do the same. They lift the bridge, but neither can make the nose tips longer or significantly higher. With filler, there are many risks. For example, if filler are injected into the tips of the nose by someone inexperienced, they can enter the blood vessel, block them, and cause necrosis of the tips. That's why fillers shouldn't be injected directly into the nose tips. These methods are only suitable for people who already have pretty nose tips and just want to enhance the bridge. But if the nose tips is a bit long, like Luna's, and you want to make it shorter, surgery is necessary. Similarly, if the nose tips is short and you want to make it longer, surgery is also required. Now let's talk about surgical method. The simplest surgical method is silicone implants. It is similar to filler but slightly better because it can improve the nose tips a bit. However, it still can make a short nose longer if the nose tips is already short and you place a silicone implants. It can raise the bridge and slightly lift the tips, but it won't extend to the length of the tips. The implants can only go as far as the natural length of the tips. If you try to make it longer, it can create too much pressure, thinning skin, and eventually causing the tips to become red or even perforate. That's why silicone implant should be placed carefully, following the natural length of the nose tip. If you try to push it further, the tips become sharper and thinner over time, and in the worst cases, it might even perforate. Not everyone is the same. When you first inserted it, it can wear away. If you try to stretch it out, it will eventually break. So the silicone bridge method can only make the bridge of the nose and the tip a bit higher. It can change the length of the nose tips. If you want to shorten or lengthen the tips, this method is not suitable. This disadvantage of silicone is that it can cause the tip to break. The second method is using cartilage from the ear. You place it like a shield to protect the skin, preventing it from breaking. The cartilage from the ear can protect the skin from wearing down. This method is called cartilage wrapping. It helps prevent the nose tips from breaking, but it still can lengthen the nose. If you want to fully reconstruct the nose, for example, to make the tip shorter and slimmer, and resave the nostril, you need to use the structural rhinoplasty, which involves two types of cartilage, ear cartilage and rib cartilage. First, you use the ear cartilage to reconstruct the tip, and you can also use the septal cartilage. The septum is located here, pointing to the nose. So if the tip too short, the septal cartilage it cuts and extends to the length tip. When you lengthen the septal cartilage, the tips of the nose will also lengthen. If the nose is too long and you want to shorten it, you can cut the septal cartilage and put it in. By cutting and pushing it in, the nose tips will shorten. After that, you place the silicone bridge. This area will consist of ear cartilage and septal cartilage, while the bridge is made with silicone. The best method now is rib cartilage, while ear cartilage and septal cartilage are a good method. These are cases where the body doesn't accept silicone implant because they are for objects. In these cases, the silicone may cause infection in 1% of patients. If an infection occurs, the implant must be removed, and you can only place it again after 3 to 6 months. Even after placing it again, it may still be incompatible. To avoid this, for those who are not compatible with silicone, rib cartilage should be used. Since rib cartilage is from your own body, it will not be rejected. You use your own rib cartilage to create the support structure for the nose, either lengthening or shortening it. And you can also use rib cartilage for the bridge as well. This method is more complex, but it is a one-time procedure with a 100% success rate. After some time after Dr. Thai share, everyone can properly guess the part of the reason why Luna decided to resave her nose using the rib cartilage method. Even if the doctor is skilled, the body types of each person is different. For example, Luna body types might cause an infection, and that would greatly affect her work. That's why I decided to advise Luna to go for that option. People ask if there will be a big scar when using rib cartilage. Doctor, for rib cartilage, we make a small incision right under the breast fold. It's hidden there under the chest, and the breast tissue will cover it. The incision is about 3 centimeters, and the scar will fade and be hidden in that area. Luna's scar is also quite small, just a short one. People commented that after getting the nose done, Luna looked younger. It's true that just changing the nose can make a big difference in many things. The nose is really important. Just a small mismatch in the length, the tip, or the placement of the bridge can completely change the person's face. That's why the nose needs to be very delicate to fit the face. It is not just about making the nose higher that easy. The challenge is making the nose blend with the face so it looks natural and balanced. It should enhance the overall beauty of the face, not stand out by itself. When the nose is done, it had to match the feature. For example, placing a high nose bridge might not work if it doesn't fit with the person's face. After surgery, it's crucial for flower off closely. If there any swelling or infection, It needs to be addressed immediately. Some people who go to Korean for surgery may return the significant swelling or infection, so close monitoring is necessary. For cases where there are silicone allergies or a previous failed surgery, using rib cartilage is only option. In the cases, patient may use rib cartilage because other method may lead to more complication. Even if they choose to use donate the rib cartilage, there's no guarantee that it won't cause an allergic reaction. At that time, Lily Luta already has a beautiful nose. She went to Korea with a friend. Her friend encouraged her to enhance her nose further. Lily Luta trusted the recommendation and decided to go ahead with the surgery. After the procedure, she came back and said, I had a surgery in Korea, but now it is so swollen. Can you check it for me? When I examined her, I found that it was severely infected. I told her that we had two options. Either I remove it immediately or I drain the pus and she could go back Korea. The hospital in Korea was a large, well-known, and I felt that Lily Luta knows what beautiful to begin with. She ended up needing to close her Facebook for a year because the situation was serious. After training the infection and removing the material, Liliuta went back to the Korea for antibiotic treatment for a few weeks. She then asked what could be done. The doctor in Korea said the only solution was using donate cartilage. Since they didn't know how to use rib cartilage, I told Liliuta if she wanted to do it again, it had to be with her own rib cartilage. Since they couldn't do that in Korea, I advised her to come back to me, but she would need to wait for 6 months before we could proceed. Usually this kind of complex procedure is rare. Even the Korean week had over 3,000 cosmetic clinics. Only a few can perform rib cartilage procedure. Most places need to be rib cartilage. Even with the rib cartilage, there's a chance it might not be compatible with the body, but the chance of complication are lower compared to silicone. Lily used to have very beautiful cosmetic surgery thanks to Dr. Thai's Admit Me Cosmetic Hospital. However, today when I met Lily, I felt something seemed a little bit different from her previous appearance. My nose is not as beautiful as it used to be during a trip to the Korea with my friends. I took some time to visit a hospital there. The doctor gave me a consultant and mentioned that I should redo my nose because it has some defects. How did the process go, and what led to the point where you had to remove nasal cartilage, as you mentioned earlier? After deciding to have surgery in Korea, about 3 weeks later, the tips on my nose start getting red and painful. There was constant discharge. At the time, I also had a fever, and I got really worried. I went to the hospital to see Dr. Thai for checkup, and he diagnosed it as infection. At that time, did you truly feel that you had made a mistake and deeply regret not listening to Dr. Thai and continuing with cosmetic surgery? When a skilled doctor has already decided and told you you should stop now, I said, okay, don't get addicted to cosmetic surgery anymore. That were truly the most regretful decision of my life. After about a week of treatment in Korea, I returned to Vietnam thinking it had healed. However, after 2 months, the discharge started again, and I had to go back to Korea to train the push and continue treatment. It kept happening like the old wound hadn't healed before the new one appeared. It was extremely traumatic because my appearance looked very bad. Honestly, after hearing Lily's story and Dr. Taya's advice, I feel a great upset and regret that with that such a decision hadn't been made right. However, it's fortunate that Dr. Tai has always been there to support Lily. So in this case, what method can we use to improve the situation? Basically, the best option left for Lily now is to use her own rib cartilage to grasp onto the tip of the nose and extend it. However, to say it can be as beautiful as before is not something we can promise, because her body condition has already experienced contraction. When an infection occurs, the tissues around the nose contract. Therefore, we will do our best to reconstruct, and hopefully it can look beautiful again like before. The nose now has been reconstructed using rib cartilage. Lily Luther knows it also made with rib cartilage and it's look beautiful. But honestly, it's not as beautiful as the first nose I did for her. Nguyen asking if his nose, which was done with ear cartilage and has been operated on twice, had thin skin and the tip is crooked. Should he have it done again? And if so, which types of surgery should he choose? If you have had multiple surgery already, the best option would be used to rib cartilage. Rib cartilage is what can address all those imperfections. I think now Luna and Dr. Thai would like to thank everyone who has been watching live stream, asking questions, and showing interest in modern nose lift method, especially today's method of using rib cartilage for the procedure. We hope to see you again in the future live stream, even more exciting topics. Goodbye and see you soon. Dr. Chiem Quoc Thai, director of Viet Cosmetic Hospital, is always updating the latest cosmetic surgery techniques to help you become yourself more beautiful and perfect with minimal discomfort and recovery time. Luna used to feel very insecure about her looks, but thanks to Dr. Chiem Quoc Thai, she was able to transform into the best version of herself today. Viet Cosmetic Hospital had helped thousands of women, both Vietnamese and abroad, as well as top Vietnamese celebrity, achieve stunning transformation, become more beautiful, confident, and successful. The hospital is equipped with the world's most advanced technologies, offering modern non-surgical beauty treatment. In 2007, Dr. Chiem Quoc Thai introduced endoscopic breast augmentation to Vietnam, making breast enhancement procedure much gentler and less painful compared to traditional open surgery method. Viet Cosmetic Hospital can make your beauty dreams come true.